There are only two things that cause people to take action. One is to move away from pain, and number two is to move towards pleasure. The students who take your classes will be only motivated by two different things. If your students can supply a superior service to their patients, they're going to have less pain because they're using their hands less. They're going to have more pleasure. They're going to have more tokens of service rendered as they help more patients get out of pain. Probably 25% of the students that you teach, when they have a look at the tools that you lay out on the table for them, will immediately understand what they're for and realize their application and be excited to try them right away. There's also probably 10-20% of the students in your class who would rather die than change how they practice and will have a real tough time thinking about using tools. It is absolutely imperative that this 75 to 80% of the class have the experience of two things. One, they need to feel that the tools used on them actually feel very much like someone's fingers when they realize that the patient is not going to know that they're using tools.
You cannot feel the tool on your skin.
If I didn't tell you I had a tool, would you know?
No.
Number two, they need to actually pick up the tool and use it, a fellow student, and experience that they can actually feel the tissues as the therapist through the tool just as effectively as they can with their hands.
It's much easier than using my fingers. I can feel more.
And as you move along and you find spots that are tight, you can actually feel them through the tool or not?
I can feel them through the tool. I can much better than I can feel them with my fingers.
This doesn't take very long to become fairly self-evident that with a short learning curve that they are actually going to be able to feel the tissues as well as they can with their fingers. And in actual fact, they will be surprised with a small amount of time that they can actually feel the tissues better through the tool than they can through their fingers. Now that's a tough thing for them to understand if you just explain it to them. If you take the time and energy to have the class pick up those tools and work on a partner and actually experience how it feels as the therapist and how it feels as the patient, at least 70 of that 80% will begin to entertain the idea that yes, these tools actually are a really good thing. Now, of course, with using the tools, the therapist is going to have less pain in the future. If you're actually supplying better service to your clients, they're going to be willing to supply more service to you. So less pain for the therapist, more pleasure for the therapist with the positive feedback they're getting from the patients, and they're going to tell other people about your service.
Do you use them regularly? And since I'm in the spa now, I haven't really, but after having it worked on me, I guess you feel like the person's going to know it's a tool, but it really doesn't feel any different. So maybe I can...
If you don't tell them,
Right,
they might not
yeah.
even realize it.
Yeah. After practicing yesterday, I'm totally comfortable using them at the spa now, whereas before I don't know, I just I didn't know how to incorporate that.
Okay.
Each tool is individually made by me in Naples, Florida. As the years went by, I could feel a real toll on my body. I could see little on the market that made logical sense. It was out of necessity that I started to invent tools strictly to save my own hands. I was pleased to be asked to put together an exclusive toolkit of extremely versatile tools for the Save Your Hands company. Okay, so you can work through there. Then you can take the little tool and work right in between the spinous processes, and I can feel right through the tool. There's the area right there. Because of the shape of the tool, it will just lift up and over and not catch on that tight muscle. I can do this whole lamina groove really precise. Right there I feel a little speed bump. Isolate one head of the gastrocs. Now we can feel right through the tool. There's something that's probably a little bit tender there. Is that tender?
Yeah.
Sometimes these two heads will actually get stuck to each other.
bring that little prong in between them. Ball. And kind of going like this. And into there, into there. A lot more effective than someone just working with their thumbs and fingers, perhaps.
Yes.
So I'm using the T-bar tool, and I'm using this flat edge.
All of these areas. You can use this on the side of the foot as well. You can use this all over this calcaneus, all of the muscle that runs right along there. She's very tender right in that spot.
There is, of course, a left one and a right one. And this one will fit right on my left thumb. And basically it's like an ectoskeleton over my thumb. So if I push against something with my thumb, you can see my tip of my thumb isn't all the way there. If my thumb was the length of the tool, I'd be using my thumb to do the work, which there are many other tools out there which are a little silly. They slide over your thumb and then you use your thumb to do the work. Well, I don't see the point in that. Applies all of the pressure right up here into the palm of the hand, and your thumb's completely on vacation. And letting it move like this, you can get in there. Now again, that one's really hard on the thumb. Now, again, if you recall, I said that we could use other tools when she was face down and get in there. Now, this finger's feeling the spinous processes, and this one's sensing the transverse processes, so I can keep the tool right in the difference between your patient getting better and just getting relief is usually how precise and how thorough you are. So the more information you have, the more you know, and the more you learn to apply it to the person, you can get tremendous results.
You're right on that one.